So in this tutorial, we're going to visualize the pathophysiology of infection. Now, for the pathophysiology of infections, you need to know that the pathophysiology is going to be divided into two. We're going to have the local and then you have the systemic pathophysiology. Is it clear? So pathophysiology just means the process by which a disease can result to its complication, and the complication can be local and systemic. Is it clear? Now, for the local complication, you have any formation of pus. Is it clear? Is it clear? It can result to formation of pus. It can result to abnormal functioning of the structure in which there is an infection. Is it clear? You need to know that among the signs of inflammation, there was abnormal functioning. Is it clear? Abnormal functioning where there is infection is also going to be involved as going to be in the pathophysiology. Is it clear? And then the next one, so you're going to have pus formation, you have abnormal functioning. Now for the systemic one, you can have the systemic spread, particularly in the cases of a septic embolization. Is it clear? Septic embolization. Is it clear? So those are the different things that you have to speak about: septic embolization, and we have also sepsis in the systemic spread with all the complication of sepsis. Are you understanding? So generally, when you have an infection, it first starts from a local region. Is it clear? Let's take an infection of the brain. After, let's say that you have a meningitis, infection of the meninges, the complication of meningitis is going to be located to pus, local complication. You are going to have first pus formation, and the pus formation include empyema. Is it clear? You are going to have empyema. Is it clear? So pus formation is going to be related to two things. When there is pus collection, it can result to empyema or it can result to an abscess. Are you understanding? So in the cases of the meningitis can result to a meningeal empyema or it can result to a brain abscess. Is it clear? Those are two complications which can occur acutely. Is it clear? So let's explain what is the difference between empyema and abscess. Empyema is a collection of fluid in an existing space, a collection of pus. When there is collection of pus in an existing space, it is going to be called empyema. While abscess is a collection of pus in a non-existing space. Example, you have a muscle. A muscle has no space in between. When there is a pus that is going to be collected at the level of the muscle, we have a muscle abscess. That is an abscess. It is not an empyema. Is it clear? But now you have what is called the pleural cavity. The pleural cavity is already a cavity. If there is pus collection inside the pleural cavity, we are going to speak about an empyema and not an abscess. Are you understanding? Still, in the meningitis, you have the cranial box. Is it clear? In the meninges, if there is pus collection inside the arachnoid space, that is already that space is already an existing space. If there is collection of pus there, it's going to be called an empyema. But when there is pus collection inside the brain has no space in it. Is it clear? So if there is direct pus collection inside the brain, it's going to be called an abscess. Are you understanding? So generally, infection is going to result to pus collection, and the pus collection can either collect inside a space or in a non-existing space. If it's inside a space, it's going to result to an empyema. If it's in non-existing space, it's going to result to an abscess. Now, the other local complication is going to be abnormal function. Is it clear? Abnormal functions. Abnormal functions, like in the case of meningitis, where you are going to have the abnormal functioning of the brain. So you can think of all the abnormal functioning of the brain, like hearing impairment, like visual impairment, like ataxia, like all the different impairment, like sensory abnormalities, motor abnormalities, seizures. All those abnormal functions you have to think about with respect to the organ that is infected. If you have the lungs, you think of abnormal functionings like respiratory failure. Is it clear? It's an abnormal function that the lungs can have. You have respiratory failure. Is it clear? You can have an edema, acute respiratory distress syndrome, resulting. It can also result to pulmonary edema. Is it clear? So all that is going to be abnormal function. That pulmonary edema is going to be as a result of another part of the inflammation, because infection results to inflammation, and then inflammation is going to have different elements. We say that there is redness. Is it clear? They say that there is heat. Is it clear? There is heat that is going to result to pain. Generally, you have heat and you have pain all together. You are going to have pain there. We have also swelling, and this is a swelling in the case of if you have an encephalitis. The swelling can result to a cerebral edema. Is it clear? Still, if you have a lung infection, the swelling can be as a result of it can be the pulmonary edema. Is it clear? So all those are complications with respect to swelling. We have also complication with respect to abnormal functioning. Abnormal function of the lungs is going to be respiratory failure that you can think of. If you have a septic arthritis, abnormal function is abnormal. The patient is not going to have the range of motion. The range of motion are going to be reduced. And we have also swelling, which is a complication. So those are the different complications that you have to be visualizing every time you have a patient with infection. Is it clear? Now the next complication in physiology is the systemic spread. And now for the systemic spread, we need to know that the major complication there is sepsis. And now we need to know the definition of sepsis. Sepsis is any signs of inflammatory response plus a point of focus. Every time that you have a point of focus and you have signs of inflammatory response, it is sepsis. And what are the elements of signs of systemic inflammatory response syndrome? The first element is tachycardia. Is it clear? Tachycardia can be considered greater than 90 beats per minute to 100 beats per minute. Is it clear? So if you have a patient that has a heart rate of more than 90 to 100 beats per minute, it is said to be tachycardia. The next one is tachypnea. When you have a tachypnea of more than 22 cycles per minute, it is said to be in systemic inflammatory response syndrome. The temperature can be either less than 36.5 degrees Celsius or is more than 38.5 degrees Celsius. Is considered under the systemic inflammatory response syndrome. And then the fourth one after that, you are going to have the fourth one after that, you're going to have the white blood cell count. White blood cell count less than 4,000 cells per microliter or more than 10,000 cells per microliter is also involved in the systemic inflammatory response syndrome. So if you have a low white blood cell count, you can consider it as a systemic inflammatory response syndrome. And if you have a high white blood cell count, you can consider it as a systemic inflammatory response syndrome. Generally, that's sepsis. Now, after sepsis, we have what is called severe sepsis. Severe sepsis is when there is sepsis plus a complication. Every time there is sepsis plus a complication, that is already called